Hello, I'm Alex Metricardi, Chief Marketing and Public Relations Officer for Living Branches, and today is Friday, June 12th. Welcome to another one of our weekly videos. I'm here today with Ed Brubaker, President and CEO for Living Branches. Hello again.
Hello again, Alex.
Well, let's start with our update, as we usually do. This week at Dock Woods, I'm pleased to be able to say this is the only place on the Living Branches campuses right now where we have any active COVID cases, and our numbers are dwindling. So we have 10 residents in Dock Terrace who still test positive for COVID, and those residents, most of them are in the Country Cottage wing of Dock Terrace. But that is the place where all of the residents who have tested positive at Dock Woods are residing right now. There's no residents at Souderton or no residents at the Willows who have tested positive. I know people always ask that, so I do like to repeat that information. We had a new development this week at the Dock Woods campus as we talk about testing. For the first time, we had a resident in Oakwood Court, which is personal care, test positive. Now that resident has since transferred to Dock Terrace, so she's in there right now. But maybe we should talk a little bit about why this was a significant test for us.
Yeah, it's an interesting situation because she had been out at another facility, another healthcare facility for a period of time, and had 2 negative tests, negative COVID tests before she came back, which is our protocol. Our protocol is also that persons coming back go on a 14-day quarantine. But the risk is, as we've always said, when you have a negative test, it can give a false sense of security, and there are still a great number of false negative tests that are out there, unfortunately. A positive test, you typically believe and do whatever you need to do. So in her particular case, then, there were some symptoms that were coming up shortly after she returned. And so she was tested and she's positive. Now the question is that a false positive? Because of the symptoms, we're not sure that it is. But the reason we tell that story, as you said, is we'd love this disease to be something we could have definitive answers on. And unfortunately, even after this period of time, which in the course of human history is still very short, but we still don't have a lot of these answers, like why do these things happen? But for us, it reinforced that idea of we need to be ever diligent and working at these things. But we also need to continue with that 14-day or some type of quarantine. That could change over time as well, but we really need to pay attention to these kind of things.
I know for us in the marketing team, we're working with residents that are new to the community, or residents who've perhaps been in the hospital and are now coming back. All of that funnels through marketing. And so we hear in our conversations with families and residents exactly how much they do not like the idea of a 14-day quarantine. But this was in some ways very instructional for the marketing team, even as a reminder of this is why we do it and we're going to continue to do it.
Yeah, that's right. And I would also reflect that in some ways 14 days feels like a long time, but I can tell you, for me and serving on the coronavirus response team, the CRT, it is always amazing to me when we get updates every meeting about staff updates or resident updates, and particularly for staff who may have been out for testing or out for quarantine or out because of positive. It's always astounding to me. It's like it's a blink of the eye and they're back. So I don't want to minimize, because it is hard, I don't want to minimize it, but in the scheme of one's life, 14 days is actually a very short period of time.
Yeah, and we need the safety that measure provides.
That's right.
Yeah, definitely. Well, another big thing that happened this week is that we were able to roll out some revised guidance on our pandemic guidelines. And we're not to green and everything's not back to normal. But we were able to take some baby steps this week, I think, that are going to make people pretty happy.
Yeah, that's right. And they were distributed on our website and via email and otherwise, so we won't go into the details here. But certainly things like visitation and other things, the reality is, as I said on the video last week, there's not a huge amounts of change from red to yellow, and even for us to green. But we do feel like we need to begin thinking about how are we going to accommodate visits. And so we're starting I'd say some exciting things on that too, where we can accommodate outside visits in a thing called a chatterbox. And perhaps we can get a picture of that, our chatterbox, on the video as an overlay this week too. But we're trying to do some things that we feel create safety for our residents and their loved ones, but also get at this need to see your loved ones. And finding that balance is a challenge, but we're working at it, and we feel good about some of the plans we're making in that regard.
And that chat box is still necessary for residents who are in healthcare, in personal care, in memory care, because we do not have, I was going to say the green light. I probably shouldn't say colors anymore because it gets confusing with all of the charts. But we do not have permission from our regulatory agencies yet that oversee those areas to start unfettered visitation. And so that needs to be reminded to people, I think.
Yeah, that's right. And if you think about it, I'm not exactly sure what you mean by unfettered visitation, but let's pretend that you meant pre-March visitation, meaning visitation in resident rooms and healthcare, et cetera. And I would say, from my perspective, that's going to be some period of time. I envision the potential for inside visitation at other parts of the facility, but to have persons actually come onto the healthcare unit, I'm not envisioning that for some period of time yet. And as you said, the state regulatory and federal regulatory agencies are charged with helping us understand more about what that means. But we do want to find ways that we can creatively have other alternatives to that possibility.
And for our residents in residential living, where we don't have the same kind of oversight from our regulatory agencies, we're talking now there about visits outside with a maximum of 2 persons at a time. And of course, everyone has to be masked and taking proper safety precautions. But even that, I think, will be very welcome.
Right. And I would say maybe another way to call the yellow and potentially even the green phase, instead of using colors, maybe we use words. And I would call yellow and green the confusing phases and the red being the clear phase. And the reason I say that is, in red, and we've talked about this in CRT, and I reflected that you're in restrictions. You know what it is. In yellow and green, you have more options. And frankly, since there's no specific mandates from the state and federal governments, we're finding our way forward, talking with other people, seeing what other people are doing. But I can say what we're doing is different than other facilities. And so for people can say, oh, well, so-and-so is doing this or so-and-so is doing that. Yes, that's absolutely true. Each place is ending up coming to their own spot. And that's what makes it confusing and challenging. It gives an opportunity for us to set the way forward, but it is a challenge in that regard.
I've heard from multiple residents this week, and it's been interesting, the spectrum of responses that we're hearing. So certainly, I've heard from a couple of people who've said, why are we going so slowly? Just open the gates, metaphorically speaking, of course, and let us do what we want. But I've had significantly more residents saying, we appreciate the fact that you're taking your time with this. We realize that the guidelines that are in place are there for our protection, and we want to make sure we're operating within those, because we realize that this could have the potential of having severe ramifications for us.
Yeah, that's right. And to pay attention to the news, it's really hard to gauge what is the normal, if you will, person doing. I'm not even sure if there is a normal person anymore anyway, but what are they doing? And it's really hard to gauge that because we tend to see in public the more extreme behaviors. But our good photographer here that takes the videos each week was sharing a story, Mike Landis was, about a family that he was taking a picture of that literally had not left their house since the beginning of this. And so I believe their elder relatives were on their same property. But the point is, there's some people that really take this very, very seriously, and kudos to them, frankly. But then you have the other side who don't wear masks and don't care to wear a mask and fight against wearing a mask. And so that really is the conundrum, if you will, that we're in. And so we need to find our path forward, knowing that, frankly, we won't please anyone. And if we please a few, that'll be great. I remember Marcus Clemens, who some people watching this video would remember, but I remember him saying once, as a trustee in a church, if you have some people putting on their jacket and some people taking it off, the temperature is probably about right.
That's a very good thing for all of us to remember as my feet are freezing in our environment today. I would propose also perhaps that the legislature did not make things any clearer this week in Pennsylvania with their vote to override something. And so maybe it's just worth pointing out as well that whatever that was, that really didn't have any impact on us.
Yeah, that's right. And certainly did not give any more clarity. I would, just a side comment on your feet. If you'd wear a closed shoe, maybe you would be okay.
It's summertime. I guess the other thing that's happening in the news this week that we've seen that gives me pause and brings some concern to me is that I haven't seen this about Pennsylvania yet, but in other states where they've perhaps been a little bit more relaxed about their pandemic guidelines, they're starting to see increases in persons testing positive.
Yeah, that's right. And the thing to keep in mind, though, with that is I would caution us to read the numbers well, because you can almost put numbers out there that can almost say almost anything that you want it to say. And so I would say the critical thing to keep in mind as we're testing more people, you will have more positives because your factors are larger. What I think we need to pay attention to is hospitalization rates, and also ICU rates. When you see hospitals filling up or the threat of hospitals filling up, that's when we need to be concerned, because that's what's been the concern all along and why we wanted to flatten the curve, if you remember that. We haven't really used that a whole lot recently, but we used to talk about that all the time. That was the reason for it. So I'm not quite as concerned with the numbers going up, because I think that will naturally go up with more testing. The big factor is making sure we don't get overrun in our hospitals with really sick people. And it is a serious disease. I mean, with regularity, I hear stories of not just persons in their 80s and 90s, but 40s and 50s in the ICU. That certainly is not the majority of the people, but it's serious if you get it in a significant way. And so it's still something we need to pay attention to.
And I saw something, at least in the Philadelphia area, saying that right now our hospital and ICU counts were in good shape, which was encouraging.
Yeah, that's right.
And it's probably also bears repeating for us that we are going to be monitoring what's happening in the wider community in our coronavirus response team, and that these pandemic guidelines that we have just released, we will be potentially modifying them based on what's happening in the larger community.
Yeah, that's right. That's a very good point. Mm-hmm.
Yeah. Hopefully we won't be going back, but you never know. Yeah. speaking, you were talking about the fact that as the number of persons who are testing increases, obviously the number of people who test positive increase. We're going to be doing more staff and resident testing at Living Branches. We've already done a lot more in the last week. So let's talk a little bit about that.
Yeah, and there actually is a mandate for baseline testing, meaning a one-time baseline testing from the state now. This would be for skilled nursing or what we call healthcare areas for both staff and residents. And so we have done complete rounds of testing for all residents in both our healthcare units at Souderton and Dock Woods already, and did our second round at Souderton more recently. So those things are underway. We've done a lot of staff testing, but it's been more symptomatic-based testing. This is going to be a baseline. So we're working at doing that later this month. I think the deadline is late July or something. So we'll have plenty of time to get that done. But we're also doing it not just in healthcare, which is the mandated area, but we're also looking at doing it in personal care as well. So it's a logistical challenge. I mean, it's unbelievable. And then even as we think about what shall we do in the future, people are still talking about weekly testing. We're not finding that necessarily to be the optimal use of funds, because this costs tens of thousands of dollars. Okay, this is not a free lunch here. But if it's the right thing to do, we need to figure out a way to do it. So we are getting to that baseline testing point, which we'll be doing particularly for staff in the next number of weeks.
Yeah, the logistics of this are extremely complicated. And I know that I've heard from a couple of different residents and families saying, when are we testing? When are we testing? And when you really think about the logistics of the hundreds of staff people that work that somebody's working 24 hours a day, on shift, off shift, thinking about getting them back, getting them tested, and then finding labs that can actually run the tests in the allotted amount of time, it's not simple.
Yeah, that's right. And we're finding, I think we mentioned this last week as well, our lab that was getting down to 24 hours is now back up to 48 to 72 hours for results. And so it's just a challenge. And so we, as the boots on the ground, kind of know what's going on, and it's not always as it may be stated when officials talk about the ease of testing, et cetera. There's a lot of details, as there is with everything in life, when it comes down to taking care of the details of a particular project.
Yeah. Mm-hmm. Maybe let's talk for a second about some changes in the wider community. We've talked a lot about what's going on here, but let's also talk about, there was a change today in the Mennonite, or this week in the Mennonite world that we heard about.
Yeah, and it was actually announced on Pentecost Sunday, or Pentecost, I should say, May 31st. And there was a special service that was a Zoom or a virtual service done by the conference. Franconia Mennonite Conference, which is our sponsoring body for Living Branches, merged, I guess, in 2019 with Eastern District. And so the connections between those conferences have been very close for many years, but this was more the formal merger of them coming back together. Then we wanted to develop a name, and the conference needed to develop a name. And so that was unveiled on Pentecost on the 31st of May. And the new name is Mosaic Mennonite Conference. And so if you look up Mosaic Mennonites, you can look that up on the web. And so I think it's a great name. The concept, I really think of what they were getting at, and you can see this all on their website. But the idea of, we are not this small, quiet in the land, Eastern Pennsylvania group. Literally, there's churches in California, Florida, Eastern Pennsylvania, Vermont, many different places. And so conferences, and all conference means is those are the organizing body of congregations. And part of it is that Mennonites come together to confer, to together figure out what should be done, as opposed to coming together to listen to the Pope or whomever to tell us what to do. So that's some of the origins of the names. But the idea is that it's a mosaic of a lot of different persons. So traditionally conferences were more geographic oriented, and now geography is not the dictating feature. The commonality of belief systems and other things like that would be what brings it together. So it's a mosaic. It's a lot of different people coming together, and so that is the new name for our sponsoring body, Mosaic Mennonite Conference, and you can look that up at mosaicmennonites.org.
And then perhaps you want to introduce our next video.
Yeah, and I think perhaps people, if you reflect on some of the videos, we've used music at various times, and songs that I would have connected with or found, and we want to do that again this week. For me, I've always enjoyed music. Unfortunately, I don't have musician talent. Our daughter does, but I don't. But I love music, and it really touches my heart and my soul. And so when I hear those songs out there, we shared one last week and a few weeks before that, music touches people in ways that other things do not. And that's certainly part of the reason why we have a music therapist here, Seth Laux, and just our focus on those creative arts, because it touches the soul, I think, in ways other things do not. And as I think about these challenging times, and frankly, we are not through this yet, how do we continue to maintain our centeredness? How do we continue to connect with those deeper things within our being? And I think music is one of the ways to help us do that and reflect. And so this song is actually done by the Doc Mennonite Academy Touring Choir. It was on our virtual service at our church at Souderton Mennonite a few weeks ago, and I'm sure it's been used elsewhere as well. But it's a song called I Believe by Mark Miller. And the theme, the thematic element is, even when God is silent or I don't see what God is doing, God is still there. And I believe that God is still there. And I would say, as we reflect on these last months, and last week we talked about George Floyd and some of the things related to the unrest in this country and racial relations. We've talked about COVID. It's an unsettling time. And sometimes it is easy to forget or say, where is God in all of this? And so this is just a wonderful rendition by the Doc Choir, and something we'd like to close with again today.
I believe